Well, hello from Australia, everybody. It's an honour to be invited to chat with you during International Nurses Week. I'm actually at home today, but this picture you can see is a historic building at our university in the city of Fremantle, which is about 20 kilometres from the main city of Perth in Western Australia. So this is a photo. We always acknowledge our Indigenous communities, and there are many different Indigenous communities in Australia, and we always acknowledge them before our lectures and our meetings. And I think this is a really beautiful aerial photo that is taken in the north of the country, and you can see the red dirt and the white sand and the beautiful beaches. So this acknowledges that our university is on Whadjuk country, and we always acknowledge those people. So I'll tell you a little bit, I guess, about the university at which I work, and then I'll tell you a little bit more about nursing in Australia. And I understand that we'll have the opportunity for questions and answers after you see this. So the University of Notre Dame is a Catholic university, and we train within the context of a Catholic faith. It is a small private university, and there's a big focus on pastoral care. So making sure that we know all of our students, and they're not just a number within the university community, but we know them as people. And because we're private, we can do that. It also costs more to go to this university because it's private. And that then means that our class sizes are quite a bit smaller. So this picture down here is from our Fremantle campus, and this is a beautiful place to have lunch and meet with students. So we have 3 campuses. So this top one here is in Fremantle, and it opened in 1989. The second one here opened in Broome, and Broome is a beautiful town, but it is renowned for its pearls. Its pearls are shipped all around the world, and there is big pearl farming in Broome. That is a very small campus that we have there. And then we have another campus in Sydney, and that opened in 2006. But the Fremantle one where I work is actually the largest one. I don't know if any of you have heard of Fremantle, but I guess it became quite famous when the America's Cup was held here a long time ago now, but that really injected a lot of money into Fremantle because it is a port city. A lot of cruise ships come in there. Live sheep and cattle exports leave from Fremantle. It's a very busy port, and it's a lovely place to work. But this is just an old photo of when Australia won the America's Cup for the very first time, and it was defended back here in Fremantle. So a lot of people have heard of Fremantle for that reason. So Australia is a big country, and this circle down here is Perth, and Fremantle sits just south of this. And this is Broome up here in the north of the state, where there's a big pearling industry. And of course, Sydney, which is it's not the capital of Australia, but it's certainly our largest city, and it sits over here on the east coast. So those 3 circles show our 3 campuses of our particular university. Your dean and I have been chatting a little bit before this presentation, and it's really interesting for me to hear about nursing in Colombia. It sounds like it's very different to nursing in Australia. We really have, I guess, 2 levels of nursing. I understand you have nursing technicians, and we have those too, but they have either 1 year's training or 1.5 years training. But most of the hospitals are not allowed to have more than 20% of these nurses, who we call enrolled nurses in Australia. They certainly cost the hospital less money, but the decision has been made that for patient safety, we cannot have too many of them working in the wards because their level of training is not high enough. They certainly help the qualified nurses, but there is a limit to what they can do. So maximum 20%. So for me, as a registered general nurse, all nursing for us is based in a university. You can either obtain a Bachelor of Nursing degree, and that will be over 3 years, or some universities offer a Bachelor of Science with a major in nursing, and that is usually 3.5 years. But both of those qualifications will allow you to be registered with the Australian Health Practitioners Association. And that registration is what allows you to get a job. If you are not registered, you can't get a job. You are not allowed to practice in Australia. The minimum number of hours that the Australian Health Practitioner Agency says that you can that you must do in order to become registered is 840 hours over 3 years. The difference with our university at Notre Dame is that we offer 1,200 hours. So a lot more practical experience, which means that our graduates are very sought after. Employers and hospitals really want our graduates because they are a lot more ready to start work when they graduate, having had quite a lot more practical experience. That may change in the future, but that's what it is for now. After you graduate, after your 3 or 3.5 years, many of the hospitals offer what they call a 1-year graduate program, usually at our big main hospitals. And that helps those students, they get extra support, extra education, and it really helps them consolidate their university learning so that they can go out and work independently and work safely. So graduates are really try and look for and get onto a graduate program. It's a very good thing to do. And there's a lot of competition to get into a graduate program. And once you're finished that, then there are many, many areas of postgraduate study that you can go on to do. And pretty much all of the universities in Australia who have schools of nursing and midwifery offer a range of graduate programs. And it's quite common now that graduates will go on to do extra qualifications. So they might be in critical care, so in intensive care, coronary care, cardiothoracic care, looking at transplants. They can work in forensics, forensic medicine. You can specialize in emergency or in pediatrics, in operating theatre, in eye, in ophthalmology. So there are many, many opportunities for postgraduate study. And so this slide here just gives you a sense of what some of those I guess the levels of postgraduate qualifications are in Australia. So you can undertake 4 units of study and receive a graduate certificate, 6 units of study and receive a graduate diploma. You can do a Master of Nursing, and the government really wants nurses, or not just nurses, but the government really wants to support people to undertake research, because they believe that that really benefits the country by having more highly qualified people. So if you choose to do a Master of Nursing by research, the government will pay all of your fees, so there is no cost. So when we tell prospective students who might come to me as postgraduate coordinator, should I do Masters by coursework or Masters by research? When I tell them that if they do it by research, the government pays, and if they do it by coursework, they have to pay, not surprisingly, most of them will say, I will do it by research. Having said that, sometimes they don't come equipped. They're not ready to start working on a research project. So I might have to send them off to do some extra courses in qualitative or quantitative research methods. Sometimes I need to send them off to do statistics. And then they come back and they are ready to start their Master of Nursing by research, and at no cost to them. We also, you can do a Master of Nursing and become a nurse practitioner. And a nurse practitioner sits, I guess, somewhere between being a nurse and being a doctor. So they can prescribe medications. They have a really broad range, we call it a formulary. And within that, they have a really broad range of medications that they can prescribe. The nurse practitioner will specialise in a particular area. So they might be a wound care nurse practitioner, or they might be a heart transplant nurse practitioner, a renal nurse practitioner, an emergency nurse practitioner. So they work within a defined area, but they are highly skilled, and they see all their own patients. They organise all of their own investigations, x-rays, scans, pathology tests, and then they can prescribe them medications as well. So that's, I guess you've been able to do that for maybe 15 years or so. And one of my good friends is a nurse practitioner specialising in acute pain. So she works in a large hospital, and she manages usually post-operative patients with complex pain needs. So that's great. You can do a Doctor of Nursing course or a Doctor of Philosophy, a PhD, which is what I did. And there's a couple of reasons that nurses in Australia choose to do extra study. And that's because extra qualifications means extra pay. So there are 3 levels, extra levels of pay. So if you receive a graduate certificate, you have level 1 extra pay. If you have a graduate diploma, it is level 2 extra pay. And for Masters and PhD, it's level 3 extra pay. And it's quite a lot of extra money that you get every fortnight when you get paid. But of course, there's also opportunities for promotion. So it is very common in Australia that graduates will undertake some form of postgraduate study. It's a good thing, and it's attractive for the staff. So just a little bit about the Australian healthcare system, which you might find interesting. We have universal healthcare. So unlike America, which I always find very frightening that people have to pay so much money for what we would consider a basic human right. In Australia, it is free. If I got hit by a bus, I would be taken to hospital, very, very good hospitals, and I could leave a month later with no cost. As long as you're an Australian citizen, an Australian resident. So that is paid for by an extra 2% on top of our income tax. So this is called a Medicare levy, and everyone has to pay it, 2% of however much you get paid. But that means, as I said, we have fabulous hospitals, some better than others, but overall the health system is very, very good, and it is free. I guess the thing to remember though is if I need a knee replacement or a hip replacement, or maybe a cataract that needs to be fixed, because that is not an emergency, I could find myself waiting for quite a long time. They will say, well, you're not going to die from that, so you will need to wait and be put on a list in a public hospital. And that can take some time, depending on what the problem is. As I said, if it is an emergency, I could take my child straight into hospital and they will be seen and get very good care. Medicare doesn't extend to dental care. And I'm not sure about Colombia, but in Australia, dental care is quite expensive, and some people do have trouble affording that. Whilst we have universal health care, some people opt to have to buy extra insurance and have private health care as well. So, for example, our family do. I have our eldest daughter is a nurse at one of our big public hospitals. She doesn't live at home, but she also pays extra for private insurance. And our other two children, who are not children, they're adults in their 20s, but we still pay their private insurance as part of our family. And that means that if you need some surgery, you can have that done. You can go and pick your surgeon. You can say, I particularly want to see this surgeon and have my cataract done. And instead of waiting months in a public hospital, you could usually have that done within a couple of weeks. So same thing, your hip replacement, your knee replacement, you can pick your surgeon, pick your hospital, and you can have that done within a much shorter period of time. And that does also cover things like glasses and dental care. So I guess around, well, it's dropped, but I guess around 50%, about half of the adult population pays extra for that private insurance. And it's really just, I guess, convenience. And like any insurance, you hope not to use it, but if you do, you are happy you have it. My husband rides a bicycle for fitness, and he has fallen off quite a number of times. So he has had multiple shoulder surgeries, and he has got a very good surgeon who knows him quite well now because he's come off his bike so many times. And it means that he can just call that surgeon and say, yes, I've come off my bike. I need to see you about my shoulder, and he will be in hospital, tonight if he needed to be, to have a plate or something put in that. So that is the difference between public and private in Australia. There are professional challenges. It's not perfect by any stretch of the imagination. In Australia, the average age of the registered nurse is 42, and our population is getting older. We also do have an obesity problem, so we have high rates of diabetes, unfortunately, weight-related problems, and also our hip and knee replacement numbers are increasing at about 5 to 7% per year because we're getting heavier, and our knees need to be replaced. So as our population is aging, we will need more nurses. Recruitment and retention of specialist nurses remains a problem, and universities have been asked by the government to graduate more nurses. So we have been asked to increase our number of graduates. The problem with that is that the hospitals want skilled nurses, but of course you only develop skills when somebody has given you the opportunity as a graduate to go in and develop those skills. So a lot of graduate nurses will say they're having trouble getting jobs, but the hospitals are desperate for skilled nurses across a lot of areas. We also have a shortage of midwives. So I know our big tertiary obstetric hospital here is advertising for 60 midwives, and I don't think they're going to get them. So there is certainly a skills shortage here. On the other hand, nurses are highly respected in Australia. Every year they do this sort of survey looking at who is the most trusted profession and the least trusted profession, and nurses are generally 1 or 2 every single year, so they enjoy high levels of respect in the community. As I said, once you're experienced, there are very good job prospects. You can travel around, it's a big country, and there's lots of opportunity to work, not just in country areas, but people who want to go into more country areas or even remote areas. And that also attracts extra money for going to work in those areas. You would have to work this out. I'm not sure how this correlates with pay in Colombia, but when a nurse graduates and starts, she will start on about 60,000 Australian dollars, but that is without shift work allowances. So you get extra money for working evening shifts, you get extra money for working night shifts, you get extra money for working public holidays, bank holidays, and weekends. So you would start at 60,000, but there were always allowances every pay, so it will be more than that. Once you become a senior nurse, it would be more like 120 to 130,000, and for academics and managers, around 120, 130 to 150,000. So I think it's not just a perception. Nurses haven't always been well paid in Australia, but I think the government and the community understand that we are really the backbone of health in this country. And if they want more nurses and they want to retain nurses, then they really need to pay them properly. And so that's been great. Just quickly, I wanted to tell you about COVID, and your dean and I were talking earlier, and I said we are very, very, very fortunate in this country because we're essentially a big island. The government just locked it down. You cannot travel to Australia, and we cannot travel to Colombia or anywhere, in fact, except New Zealand. We have what they call a travel bubble. There is no COVID in Australia, there is no COVID in New Zealand, so we can travel between those countries. The only COVID that we have here at the moment is from Australians who are returning from overseas. And because there are high rates of COVID in those returning travellers, they must all go into quarantine for 2 weeks and have 3 negative COVID tests before they can then be allowed back into the community. And whilst that's tough, it has what's kept us safe. There's been around 30,000 cases in Australia, and only, I say only, I mean, it is a lot of deaths, but 910. And in fact, a lot of those were in nursing homes. So COVID managed to be introduced by visitors or something who had picked up COVID in the community. And then, of course, it had spread in a really vulnerable patient population. So the other area that we picked up COVID was from cruise ships, who in fact were initially, so international cruise ships, which were initially not allowed to dock in Australia, but then when passengers on board started developing symptoms of COVID, the ships had to dock here, and some very, very ill patients went on to die in our hospitals. So yeah, that's very sad. So at the moment, returning travellers are going into hotels. And there are some problems with that, because hotels were not made as quarantine facilities. But it's largely working, but it's not ideal. The government is talking about actually using a couple of refugee camps within Australia and having those as COVID facilities to try and increase the number of Australians being allowed back in. Of course, things are pretty grim in India at the moment, but there are a lot of Australian citizens there, and they need to be able to come back home, but it needs to be done in a safe way. Mass vaccination is underway. I've had the first AstraZeneca vaccination, as has my family, or my older members of my family. The start was a bit slow, but it's improving now. And sadly, a lot of people are saying they won't get the vaccine because they don't see COVID as a problem, because we don't really have any in Australia at the moment. We can travel freely within the country. We can go to sporting events. We don't need to wear masks. In fact, life is completely normal for us here, except that we can't travel anywhere overseas except from New Zealand. But New Zealand is beautiful, so that's okay. That's not a bad thing. So there you go. I guess that's just a little bit of a snapshot of my university, the University of Notre Dame, a little bit about healthcare in Australia, how we train nurses, what our opportunities and challenges are, and how we've managed COVID, which in a word is pretty well. So we are fortunate, and we look across the world and send our best wishes, because Australia is actually sending a lot of the equipment that we stockpiled for COVID, because we don't need it. We are sending a lot of it to other countries who are struggling with outbreaks. So we're sending a lot of ventilators and oxygen at the moment to India. We've sent it to Indonesia. And as a country who are very fortunate, that is our responsibility to help other people. But I hope you enjoyed that bit of an insight, and I look forward to answering any questions that you may have for me.